of the garment. Well, I want to point out that we in medicine follow our path, but there's also paths taken in investigation that really affects our ability to take care of patients and what we should learn, but whose paths parallel our own and don't cross or don't intersect our paths directly. And I want to point out what research is being done by engineers, specifically engineers in the business of textiles. Well, several universities in the United States, including Georgia Tech, North Carolina State, and Auburn, undertook a very significant study between 2005 and 2007 to really examine scientifically the properties of garments and how that impacted comfort and wearability. They developed a systematic approach to examination of garments whereby they measured multiple different properties, including those that are considered tactile properties, the garment elasticity, the compressive power, the softness and durability, as well as properties that can be categorized as moisture, such as the evaporation of water from garments and its wicking ability and drying ability, as well as thermal properties such as insulation and permeability. All these factors have been scientifically reviewed so that mathematical equations have been developed that look something like this. Now, this perhaps doesn't affect us directly, but it does affect us indirectly in that scientific study of garments is based upon measurements in a laboratory, measurements that impact the wearability of a garment, its comfort, and how patients are able to use it. Let me speak for a few minutes about the types of garments that are used or the types of fabrics, because as a plastic surgeon, this is not something that you learn when you go through your training. When I first started learning about fabrics that are used for compression, the only thing I knew was that I knew how to do liposuction, I knew how to do it well, the techniques involved, the safety issues, and then I had my nurse put the patient in a garment because I knew that from experience and what I was taught that that was the appropriate thing to do. But medical fabrics actually can be broken down into different types. There are woven garments and knitted garments. I want to say that woven garments are garments in which the fibers crisscross each other at right angles to each other. They do the job of compression very well. Unfortunately, they're also very expensive to manufacture. So most of the garments that we use, if not all of them, are knitted garments. And knitted garments can be divided into, and by knitted garments, I mean that the garments are designed in such a way that the fibers that make them up follow, rather than straight paths, looping paths. And the way that the loops occur can follow many different directions. Warp is a type of knitted garment that follows a direction that you see here. The warp type of knitting, in the warp type of knitting, the garment fibers tend to follow a vertical direction, whereas in weft knitting, they follow a horizontal one. And within the warp knitted garments, which are used for compression garments, there are tricot and Rochelle knitted garments. It's the Rochelle ones that really are the ones that make up the compression garments that are used today and that have always been used traditionally. This is some of the language that most plastic surgeons are never made aware of or never become familiar unless you really study. And for many years, the type of garments that were used for the purpose of applying to patients' bodies after liposuction were power net. Power nets were garments designed probably about 75 years ago and to this day continue to be used as the main type of garment used for liposuction. There have been tremendous advancement, as I mentioned to you, in the field of textiles that allowed for advancement in the field of garments, including one that's called ComfortWeave. I mentioned PowerNet has been around for 75 years, and ComfortWeave is a relatively new garment that was designed back in the mid-1990s. Both are made out of the same raw materials. They're made out of nylon and spandex, which are artificial materials. I want to say that nylon was designed back in the 30s, really, in the era of World War II, as a way of replacing silk that was used for parachutes, for example. And spandex was used in the 50s and developed at that time by DuPont Company as a synthetic way and as a substitute for rubber because it had elasticity. The different designs of the garments reflect the different compositions of these two main ingredients, nylon and spandex. ComfortWeave is a much denser type of woven fabric. It is made primarily from a spandex grid to which is lightly added nylon. And PowerNet, which you see on the right, which is the older garment, is an open lattice that is made primarily of nylon, 75%, and 25% spandex, which is wrapped around the nylon core. So here you see microscopically the two different fabrics that we're talking about. And here you see what the fabrics look like. As I mentioned, PowerNet is the much older fabric that's been around for many years, and the majority of manufacturers of these garments, including Design Veronique, Caramed, Jopes, etc., use PowerNet as their fabric.